Hi, my name is Raleigh. I'll be your student nurse today. I'm going to be doing a physical assessment on you. Can you tell me your name and date of birth?
Abby Kirsch, 4199.
I'm just going to be checking that against your wristband. Everything matches. I'm going to be washing my hands and putting on gloves. First, I'm going to be assessing your skin just to check for color appropriate to ethnicity. I'm going to be checking the turgor for dehydration, risk recoil, temperature, which is kind of cool, but it's cool in the room, moisture, and any lesions. Okay, next I will be checking your nails. Next,
Skin for breakdown.
oh, yeah. Next I will be checking your areas of skin for breakdown. I'll be checking your occipital area. I'll be checking behind your ears. Checking your shoulder area, elbows, your scapulas, good, spinal area, sacral and coccyx area. Be checking your greater trochanters, your knees, heels, and ankles. Very good. Now I'll be checking your nails on your hands and feet. I'll be checking them for shape, color. I'll be checking your capillary refill. It's less than 3 seconds. I'll be checking the texture, any ridges. I'll be checking for clubbing as well. And lastly, I'll be checking your hair. I'll be checking the color, which is a nice brown color. Texture would be fine, soft. And then I'm going to be checking for distribution as well. I don't see any balding or alopecia present. Okay. Next, I will be going over your head. I'll be assessing the shape and size and proportion to your body, and I'll be checking for symmetry, bilateral. Next, I'll be checking your face. I'll be checking the color appropriate to ethnicity. I'll be checking for any lesions or wounds. I'll be checking for symmetry. Can you smile for me? Okay. Settle. Next, I'll be checking your eyes. Oh, I'll be palpating your skull, actually. Sorry. I'll be feeling for any tenderness. I'll be feeling for any indentations and any bumps or masses. Okay. Now I'll be checking your eyes. I'm going to be, can you raise your glasses for me? I'm going to be assessing perla, making sure your pupils are equal, round, reactive to light, and that they accommodate. Can you look at the pen light and look at the wall? Look at the pen light and look at me. Look at the pen light and look at me. Okay? I'm also going to be checking your sclera. Can you look that way, please? I'm going to be looking for any jaundice. Can you pull your eyelids down for me? Conjunctiva are pink and moist. Eyeballs and corneas are intact. iris color is green, I would say. And I believe that, and I would be checking for edema, which I do not see. 2 more things. Oh, symmetrical bilaterally. Is that all? Per direction? Like that you can measure. Oh. People measurement. I would say about 3 millimeters. Okay. Next, I will be checking your ears bilaterally. I'll be checking them in regards to size, and if they're symmetrical, and I'll be checking them for any discharge or drainage, which I do not see. Next, I will be checking your nose. I'll be palpating and assessing. I'm just checking for any deviation in your outer nose. Next, I'll be looking in your nose. Color is pink and it's moist. Can you close one nostril for me and blow? And do the same with the other tongue. They're patent bilaterally. I'm checking the color, which is pink. And I already said it's moist, and I didn't see any discharge or drainage. Okay. Next, I will be looking in your mouth. Can you say ah? Okay. Uvula rises midline. I'll be checking your hard and soft palate. Your buccal moisture, which is pink and moist. Can you pull your lip down for me so I can see your gums? Pink and moist. Your teeth are in good condition, and they're your actual teeth. You have a chip in your left front tooth. And I believe that's all.
That literally happened today.
Is that all? Okay, next I will be assessing your trachea. I'll be making sure it's midline. Can you swallow for me? Okay. No masses or lumps. And it moves symmetrically. Okay, next I will be assessing your lymph nodes. So we'll start with the preauricular, submental, submandibular, tonsillar, anterior cervical chain, posterior cervical chain, and supraclavicular. Okay, next we will start with the cardiovascular peripheral vascular system. I'm going to be starting with your carotid arteries. I'm going to be feeling one at a time, but I will be judging them as symmetrical bilaterally. I will be grading them on a scale from 0 to 4+. +3. +3. Okay. Next, I will be, is it inspecting precordium or listening to heart sounds? Neither. Jugular vein distension. So I would have you lay back and crane your neck so I can see your jugular vein. Then I would slowly raise your head of bed, and it should resolve at 30 degrees. Now it's your precordium. I would assess your bare chest, and I would assess symmetry, and I would assess for any pulsations, and a contour. So, okay, next I will be listening to your heart sound, and I would also be doing this against the bare chest. So I'll be listening to your is it aortic? It's the first one. is right sternal quarter, second intercostal space. Pulmonic, which is left sternal quarter, second intercostal space. Herb's point, third intercostal. Tricuspid, fourth intercostal. And mitral, fifth intercostal, mid-clavicular. Okay. Next, I will be assessing your peripheral pulses. And I will be doing this bilaterally, or I will be judging them bilaterally, grading them on a scale from 0 to 4 plus, and assessing if they're symmetrical. Okay, we'll start with temporal, +3, brachial, +3, radial, +3, ulnar, femoral, popliteal, dorsalis pedis, posterior tibialis. Okay, is that all of them? Next I will be assessing you for edema. I will be checking if it is generalized or peripheral edema. And I will be checking if it is pitting versus non-pitting. If it is pitting, I will be grading it on a scale of 0 to 4 plus. Okay. I don't see any edema. Next will be the abdominal. Or no. Thoracic and respiratory. Sorry. I'll be checking your interior and posterior thorax for symmetrical rise and fall. Symmetrical movement. No. Symmetrical rise and fall. Contour. Symmetrical rise and fall. Rhythm and depth. Pulsation. Bilateral. Symmetrical bilaterally. There's 5 total, isn't there? Use of accessory muscles. It's not contour. Shape. Okay. Shape. So shape, symmetrical rise and fall, symmetrical bilaterally, use of accessory muscles, and rhythm and depth. Okay. Next, I will be assessing your lateral to antero-posterior diameter ratio. So that just means that your ratio laterally should be twice the size of your antero-posterior ratio, or diameter. Which yours is 2 to 1. If it was 1 to 1, that would mean you could be barrel chested. Next, I will be checking your thoracic expansion. So I'll have my thumbs either side of your T9 and T10 vertebrae. And I'll ask you to take a slow, deep breath and check for symmetrical movement of both of my hands. Is that right?
Mm-hmm.
Okay, next I'll listen to breath sounds against bare skin. Or no?
Mm-hmm.
That is right?
Mm-hmm.
I'll be listening against bare skin. I'll be listening to 8 anterior spots and 10 posterior spots. And I'll be checking if they are clear or adventition. Okay, so the 8 anterior would be 1, 2, 3, 4, 5, 6, 7, 8. Posteriorly would be 1, 2, 3, Next, we will be doing your abdominal, and I'll be assessing your abdomen first for shape, symmetry, masses or enlarged, or wait, no, just masses or lesions. Is that one? Masses and lesions. Okay, masses, lesions. Symmetrical pulsation. Is that all? Okay. Next, I will be listening or feeling. Listening. So I'll be listening to your 4 quadrants in the correct sequence, and I will be checking for the presence of bowel sounds. And before I could say there's no bowel sounds presence, I would have to listen to 5 whole minutes in each quadrant. Okay, so I'll be going first quadrant, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Very good. Bowel sounds presence and all. Next, I'll be palpating your abdomen in the same sequence, and I'll be assessing for tenderness, masses, or enlarged organs. And that's all in the correct sequence. So tell me if anything's tender. Pops there. Want me to tell you a funny story about that? Okay. I didn't feel any enlarged organs, so we're good. Is that all for abdominal?
You just forgot to say you have to do it against
Bare skin. Okay. What?
Oh, I accidentally put it on full screen.
Oh, okay. Next is neurological, right? Okay. So I will be assessing your level of consciousness in something else.
Speech and understanding.
Okay, level of consciousness, speech, and understanding. So I'll be checking your basic memory. Can you remember the word red for me? I'll be assessing if you are alert or awake. I'll be assessing your appropriate response, your voice clarity. I'll be assessing your ability for spoken or written word. And I think that's all. One more. Appropriate response. Voice clarity. Spoken or written word. Understanding. Level of orientation. To date, does it say anything or just level of orientation?
It just says orientation.
Okay, orientation. To date, so can you tell me your name and the year?
Abby in 2025.
Okay, very good. Next, I will be assessing your balance. So I would have you stand on one leg at a time, or I would do the Romberg's test, which was where you close your eyes and I could slightly push against you, see if you can stand. Next, I'll be assessing your gross motor skills, and I would have you walk in a straight line, see if you were able to walk. Next, I'll be assessing your fine motor skills, if you could press against your opposing pelvis. Very good. Next is cranial nerves. Okay. First nerve is optic nerve. I know the cranial nerves. First nerve is olfactory nerve. And it's a sensory nerve. And I would have you close one nair at a time and have you identify a smell. Second is optic nerve, and it's a sensory nerve. And I would have you tell me how many fingers I'm holding up. Number 3 is oculomotor, and it's a motor nerve. And I would have you follow the pin light with your eyes only, up, down, and diagonal. Is there another test for that? Perla. I would check your perla and accommodation. Pupils response to accommodation. Number 4 is trochlear, and I would have you look down and in towards your nose.
What kind is it?
Oh, a motor. Sorry. Motor?
I was doing what you said to do.
Oh, okay. 5 is trigeminal. Right. And if you're in a coma, I would check your corneal reflex. But since you're not, I would have you close your eyes and identify if this was soft or sharp. Or you're chewing. Number 6.
What kind are they? What kind is it?
It's a motor. It's a both. Sensory and motor. Number 6 is abducens, and it's a motor, and it have you look left and right, just your eyes. But, number 7 is facial, and it's both, and I would have you smile, frown, raise your eyebrows, and I would have you taste, identify if it's salt or sugar. Number 8 is vestibulocochlear. It's a sensory nerve. And I would have you close your eyes and identify either whispering or where I'm rubbing my fingers together. Okay, number 9 is glossopharyngeal. And it is it's a motor. Sensory. Both. Sensory.
Both.
It's number 9, glossopharyngeal. 7 is facial. 8 is...
Yeah.
Okay. Both. And I would have you swallow, and I would check your gag reflex. Right? Number 10 is vagus. It is both. I would have you swallow, check your gag reflex, and assess your voice quality. Number 11 is accessory, and it's motor. And I would have you press against my hands with your elbow. Number 12 is hypoglossal, which is motor. And I would have you stick your tongue out and then move it internally from cheek to cheek. Is that all? Next is musculoskeletal. So I will be assessing your posture and balance, right? So whether or not you have a straight or curved posture. And I would be assessing your gait for steady or unsteady, which I did during your gross motor skills assessment. Oh, what is that word that I asked you to remember?
Red.
Good job. Posture, gait, general muscle contour,
Tone. Yeah.
tone. So I would be assessing your muscles for size, not symmetry. Oh, size, symmetry, proportion to body, atrophy and contractures, and contour. Next, I will be assessing your grip strength, hand grip strength, or no? Oh, inspecting your precordium. I'll be looking at your bare chest. And I'll be assessing for symmetry, contour and pulsation. Next is hand grip strength. I would have you grab both of my fingers as hard as you can. And I would grade that bilaterally and for strength on a scale of 1 to 5.
Inequality.
Strength, yeah. I would grade that bilaterally, equal bilaterally, on a scale of 1 to 5. Next is dorsal and plantar flexion. So dorsal would be bringing your foot towards your head, and plantar would be pushing it against my hands like a pedal. And I would be grading that symmetrical equality bilaterally. Is that from 1 to 5? Great, from 1 to 5. Okay. Next is active range of motion. No.
It is range of motion.
Of neck.
Mm.
Range of motion of neck. So if you could repeat after me, neutral.
Neutral.
No, like doing what I'm doing. Neutral, flexion, extension, right lateral, left lateral, circumduction. I think that's all. And neutral.
Did you say extension?
Flexion and extension.
Okay.
Now it's range of motion of peripheral extremities. And I would verbalize that if I had to help you or assist you in any way, that would be your passive range of motion. But the passive range of motion is the same as the active range of motion. I would just be assisting you.
You have to verbalize that it must be done bilaterally.
Okay, yeah. Okay. I'll be doing the active range of motion bilaterally in your extremities. So we would be doing elbow extension and flexion, arm abduction and adduction, circumduction, radial and ulnar deviation, wrist pronation and supination, and then we would be doing legs, knee flexion and extension, circumduction, abduction and adduction, ankle inversion and eversion. Is that all?
Mm-hmm.
And then if I had to help you with any of those, that would be a passive range of motion, but it would be the same test.
Mm-hmm. Good job.
Is that all?
Mm-hmm.
Look at that top. That was pretty good.
I think that you would pass.
But I can only miss.
You can miss a point on each one, and I think you missed a point on each one.
I can't miss a point on each one. Most of them I have to make full points.
The stuff that you need to get is like verbalized.
Yeah.
But that's the thing, like those are the ones where you can miss one. So if you don't say it, it's okay. You know what I'm saying?
Mm-hmm.
Like most of the ones that are saying verbalized.
I know what it is. It's just sometimes I get them confused on like what category and what order, if that makes sense. Anyways, this is the struggle of nursing school. I'm sorry if you feel like you've already seen this video, because this is just a different version of it. But I really need to pass this foundation, so bear with me.
She's gonna do a hair on video on
Because
me
I'm
soon.
about to